increased blood pressure can be migraine headache. When the headache, that type of headache that comes when you are stressed up and it's hitting you either in front of your head or the back of your head, and it's like the head wants to explode. When you start noticing that, it might be all is not well with your heart. We also have outside headache. We have insomnia, sleeping disorders. Some persons find it difficult to sleep. Sometimes they wake up by 12 to go and urinate, and from that 12 till 5 a.m. They are counting the roof, the ceiling on the roof there, and they can't just sleep. It can also be a symptom of a heart condition. Other symptoms include angina pectoris, that's chest pain. The chest pain that comes and it chokes you up. You find it, if you struggle to hit, some persons will be tapping their chest. It tells you all too might not be well with the heart. We also have numbness of the palms and the feet. Yeah, you see some persons will tell you, it's like this, my hand. Blood is not flowing freely. It's also known as partial paralysis. You're not feeling one part of the hands or on the legs. It tells you all is not well, with the heart or with the blood pressure. Dizziness is another symptom. Some persons start staggering. Some persons will tell you that when they woke up in the morning, the house started to turn. And when you notice that the house is not actually turning, it's a condition that is making the house to turn. So when you notice that, please don't stand up from your bed. Or when you see someone that is staggering, don't allow them to fall, because if they should fall, they might end up with a stroke. So that dizziness sets in, the house begins to turn, is another symptom. We have profuse or abnormal sweating. The person sweats too much. We have palpitation. The heart beats too fast. If palpitation is not arrested, it can lead to a heart attack. That's another symptom. We also have a man who is having erectile issues. He would also, a man who is having high blood pressure, a heart condition, might develop erectile issue. And a woman who is having a heart condition to like increase blood pressure, if she is pregnant within the first trimester, the pregnancy might be at risk. So these are a few symptoms we have in terms of heart related disease. Unless I even before I hand over, it's important to note that drug abuse is one thing too that causes heart conditions. We see some, if you remember the story of Michael Jackson many years ago, he died as a result of a drug abuse, a painkiller. Some persons take paracetamol every day. Some persons take painkillers every day, even without a prescription. When you build caffeine, so much of caffeine into your system is the same caffeine you get from coffee and the rest. This caffeine takes away pain, it calms your nerve, but on the long run, it can also shoot up your blood pressure.
Talking about caffeine, the coffee contains caffeine, but they have this decaffeinated coffee. What do you have to say about that?
Well, when I hear decaffeinated, decaffeinated is a strong word. But practically, what gives coffee its flavor is the caffeine. When you take away the caffeine, the coffee might not have that flavor that we enjoy. So you can tell me that the caffeine has been reduced in the coffee, but you can't convince me that you have taken the caffeine completely away from the coffee. Yeah.
All right, go ahead. You were mentioning.
So what are the other symptoms a person might notice in terms of heart condition? And even lest I forget, it's also important on drug abuse. We see some men who are having problems with erection as a result of maybe a medical condition, which might be an infection, a BP condition, or the rest. Instead of meeting a consultant, they want to have prolonged erection. Some men will say they want to have intercourse for 3 hours, and you see them going to take some drugs to have prolonged erection. Now, for a man to have an erection, the testosterone talks to his brain talks to his heart, the heart pumps blood down there. So it is the blood the heart is pumping that is giving you that erection. And within that period, the heart is, using more pressure to sustain that erection. So when a man begins to take some drugs because he wants to have prolonged erection, it might lead to a heart condition. And that is why some of the times you hear that a man was having sex and he developed he had a cardiac arrest, he had a heart attack. And we see a lot of them, up to about 90% of them who have heart attacks during sex, they die on the spot, meaning they don't even leave the room alive. So if you have a erectile condition, try to, find out what is causing it. Don't abuse drugs because you want to have prolonged intercourse. It might come back to, haunt your heart. So we see that as one of the conditions. And also we have some persons who are developing heart conditions. They might notice They might have blur vision, they don't see things clearly. They might be hearing sounds even when the place is quiet. They will tell you that what is making that noise. So they get this buzzing sound on the ear. And of course, at times you see a lot of them when these conditions become complicated, and it might result in a complication. A complication means that if it is not managed, it can result in a heart attack, it can result in a stroke, where some persons had full control over their body, and they slept and woke up in the morning, they discovered that one part of the body is not working, or the person is having heart attack. And heart attack mostly comes at night, so some persons are not even able to
Really?
get, yes,
Hmm.
so some persons are not even able
Sorry.
to get to a hospital, due to the fact that at that point in time, there's no car, and you see them, they die as a result of that. So it's very, very important that we watch out for these symptoms and take preventive measures.
All right. I know a lot of people have questions to ask. Mr. Efan, you can call him up. He will give you a WhatsApp line through which you can reach him after this program in case you need any health advice. He will give you the number right now to send your WhatsApp. Only WhatsApp. Don't call the line, please.
Okay, the phone number is 080 99 068 777.
Take it again.
I'll take it again. 080 99 068 777.
Okay. You can do him a text message or you do him a WhatsApp message. He will attend to your questions. So, Mr. Fanga, what is the way forward for our health? Is there any hope for us, heart health wise?
I always advise that the best approach to health matters is the preventive approach. Why? Because it is cheaper, it is safer, it is better. On the heart health, we advise that at least once or twice in a week, especially with those who are always very occupied, check your blood pressure. It's best to check the BP first thing in the morning. Check the blood pressure, and you can get an home run to
What's
check.
an home run?
Home run is a digital
Blood pressure
your
checker.
blood pressure checker. And for those that have the home run too, this is from experience. I always advise that from time to time you can also visit a health center and or a pharmacy and use the mercurial speak and check, because sometimes the home run can malfunction.
Please wait. You're using strong terms. You said home run and what? So maybe you're talking about the digital and the manual blood pressure checker, right?
Yes.
Okay, just be specific about it.
Okay, so some persons, I think sometime late in the month of September, we had someone who said he had an home run at home, and when he uses it, it gives him a blood pressure of 120/80, but he had not been able to sleep the last 3 days, and he came to check the blood pressure in the course of our campaign. So we used the manual checker, also known as the sphygmomanometer, and we checked and saw that the blood pressure was actually very high. And if he didn't check, he wouldn't have known. So those home run, when they are used for long, the batteries can become weak, they can malfunction. So we always advise that you alternate so that you can compare the values and know which is giving you. But the manual is very accurate, and that's why lots of health medical centers use it. We also advise that outside frequent checking of your BP, also make out time to regularly check your cholesterol levels. Some persons do it once in a year, some people do it twice, some up to 3 times in a year. When you check your cholesterol level, it is high, you don't need a doctor to tell you that what you need to avoid. You start, although some persons are placed on prescription, but sometimes you'll be told this is what is causing it, and you start running away from them. We also advise that you take a lot of water. Water helps your heart health, it helps your nerves. The water also helps your kidneys, so it's very important we take lots of waters. Please don't abuse drugs. Don't abuse painkillers. Don't abuse drugs. They can have a strong side effect.